I think we have started broadcasting now. Good evening to everybody. We will begin with the session now. I would request Dr. Jayaprakash Shetty sir, who is a professor and head of the Department of Pathology, Shema, Mangalore. Over to you, sir.
Good evening, Dr. Sunita, dear President of KCIAPM, Secretary Dr. Vijayapura, the Treasurer, and Dr. Aditya and Dr. Sunita Patil, and today's esteemed speaker, Dr. Sharda Rai. Today, we all joined here with the last session on synopsis writing demystified. We started with the interesting topic on selecting a dissertation topic and moved on to electronic literature search and how to write a title, and then referencing and plagiarism on yesterday. And today we are in the more so a concluding section. The most important is the art of writing of synopsis. Keep it simple and smart. It is a very apt topic. Many of the residents or the postgraduates in the preclinical, paraclinical, or clinical side, or in super specialty side, writing the synopsis as they join the postgraduate course is very important task for them. Getting it approved by the guide and going to the ethical clearance and going for the evaluator, so on and so forth. To make all this easy way, we have with us our speaker, Dr. Sharda Rai. Madam Sharda Rai has completed her MD from Kasturba Medical College, Manipal, one of the very prestigious university in this country, the Manipal Academy of Higher Education. For more than 24 years of experience in the field of pathology, and she of PhD FEMAR in the year 2007, and she's the author of 3 textbooks with 35 publications to her credit, and she is the deputy convener of Medical Education Unit, Kasturba Medical College, Mangalore, and currently she is the professor and head of the Department of Pathology at Kasturba Medical College, Mangalore, a constituent college of Manipal Academy of Higher Education, a deemed university formerly called as Manipal University. Over to you, Dr. Sharada, for an interesting concluding topic. I would say the art of writing synopsis. Keep it simple and smart. Over to you, Dr. Sharada.
Thank you, Dr. Jayaprakash, for that wonderful introduction, and I hope I will do justice to this session. To all the listeners, we have gone through a couple of topics in the past few days, and if most of you have been following all these sessions, so today's session I would like to call it as a synopsis of all the sessions that you've been listening till now. So we had a session on selecting how to select the dissertation topic. There was sessions on electronic literature searching, how to write the title, then followed by a session on study designs, what were the methods, the sampling techniques involved. Another session on how to reference properly and how to take care of plagiarism. So putting all that together, today we shall look at the art of writing a synopsis, and hopefully by the end of this you will learn how to keep it very, very simple and keep it very, very smart. So the outline of my talk is we'll just look at what it means to call something a synopsis. What are some of the general recommendations? What are the instructions for writing the synopsis? What is the structure that you should follow while writing, or otherwise what is also known as the anatomy of the synopsis? And finally, we will have a very short summary. So let's understand what's synopsis. When you look at that English terminology, it kind of just means a gist of something. So it's like a summary. You're kind of overall surveying something and trying to put across a gist of whatever you want to say. So when you have read something a lot, or when you have experiences with you, you want to summarize everything and give an overview table, then it is known as a synopsis. So it's basically the plan of a study that you're planning to do, and it has to be written. And why written? The moment you write something, you get clarity of thought, you get a very good clarity of what is the process that we need to follow. Now, there's some general pearls that I would like to share with you regarding synopsis. So, some general recommendations that we would like all of you to follow. One most important thing that I would like to tell all postgraduates: own your synopsis. It belongs to you, right? So you are doing this dissertation, and similarly, this synopsis of your dissertation belongs to you. Your guide is there on the side. So he's the sage who's going to stand by your side. Entire synopsis belongs to you. Be proud of it. Make sure you do it well. And as you're doing it, make sure you follow university guidelines. Why am I telling this? Now, I've gone through a couple of university guidelines, and I find that though most of it is similar, there are a couple of points which may be a little different in different university guidelines. So make sure you have a copy of your university guidelines and then use some of these general pearls that we are sharing with you today. Use very simple scientific language. So that's very important. Don't get worried that you don't have good English. That's not very important, but it just needs to be a little grammatically correct. But if you're using simple scientific language to convey what you want to, it is really adequate. So all those who feel that English is not your core area need not worry. As you refer into articles, refer into journals, refer into textbooks, you will learn how to use the correct scientific language. Make sure it is grammatically correct. So with these basic general guidelines, let's look at what we need to do. Now, another thing that I want to point out here is about the tense that you use. Now, when you look at most of your journal articles, they will be talking about research having been completed. So it is always in past tense. So they will say that this study was conducted, this findings were found. But when you're writing your synopsis, you're looking into the future. So your wording should be in future tense. This will be done. This shall be found. I'm likely to find this. So the tense used is in future tense. So that's another important thing you need to remember as you're writing your synopsis in comparison to what language you're likely to find in a research article in a journal where the research is already completed. So that is why you see that in past tense, that the research is already done. So now let's see what's the structure of a synopsis, what is known as the anatomy, what should it look like. Now you have gone through a couple of these things in our earlier lectures, and just to remind you, you need to have a first page as the title page, followed by which you have an introduction where you give a brief overview to what you are writing. You have your aims and objectives. You have a review of literature. You will be discussing the materials and methods, the implications of your study. You will be looking for the knowledge gap which you need to address with your study. Your references, utmost important, the references that you looked at while coming up with your study, a timeline, a budget, and your annexures. Now, as I've already said, if some of you already have a list of your university guidelines, one or two of these things may not figure in it. But I would like to reiterate, please use your university guidelines and use only what is there in your university guidelines. So let's go through some of these important subcomponents of the synopsis and see. So we'll first look at the title page. So as I've said, the title page has a format, and which again is specified by different universities. They almost follow the similar format where you have the title of the study, you have the investigator's name, so you'll have a primary investigator, which in a dissertation is the student. And along with that, you'll have the guide who will be guiding you in this study. So the guide's name has to be there. The affiliation of your institute, the affiliation of your university has to be very correctly mentioned. Now, the sequence of these contents may vary. In some places, the institute affiliation may be the first thing to write. In some university requirements, the title of the study may be the first thing to write. So use the format as specified by a university, but this would be the overall format. Some universities also have the date of submission. It may have some space for the principal to sign or the guide to sign. So please look at the recommended format as you're looking at this title page, which is the first page of your synopsis. From there, we'll move on to see what we should write in the introduction of our synopsis. Now, an introduction is like a brief background to your study. So you would have read so many things. You know, you would have your guide would have asked you to take at least 15 to 20 articles for reference, and as you go through each of them, you would have collected a lot of information. So the introduction just asks you to give a brief, very brief background to your study. You could discuss what is the need of this study, again in very brief, and what is the relevance of your study to what's happening presently, again in brief. Now you could add the context in relation to what's happening locally in relation to the topic you have picked, or you could look at what's happening nationally if that's disease of national importance, or if you've chosen a topic which is of international importance, you could go and look at what the international arena has to say about what you have taken. And a line or two could be added about the research question you have in mind. So keep in mind the word brief. So introduction has to be brief. So how brief or should it be, or how long should it be? It could be approximately 150 to 200 words. And based on the points that I told you, you could have 3 to 4 paragraphs written based on the background, the relevance of the study, the context, the loco-regional context, the international context, and one line or 2 lines introduction to your research question. Now, a word of caution here, I have used the word approximately 150 to 200 words. So it doesn't mean that if you have written 250 words, it's too much, or you have written 120 words, it's less. So there's no strict guideline with regard to this. So we're just giving you an approximate structure to your introduction. Now, I've had some students who do a self-introduction in this place. So this is not for self-introduction, nor an introduction of your guide, nor any explanations to be provided regarding your expertise. So it is solely an introduction to your research topic. Now, please remember that citing references starts from here. So you have referred many articles. Please use from where you have summarized. So please use those articles and start citing in your introduction itself. So the first article that you have referred and used in your introduction starts with reference number 1 in your introduction. So that's another important thing you need to remember. Now let's look at aims and objectives. This has been dealt extensively in our previous talks. So to just remind you again, an aim is a broad goal that you are planning to do in your study. So it's an overview of what you plan to do in your study. So aim is usually 1. While if you look at objectives, objectives could be 2 or more objectives. So you never have a single objective. So you have a main primary objective. So let's say I want to study ERPR and HER2/neu in male breast carcinomas, then that would be my primary objective, to study those markers in that particular disease. While I could have some other secondary objectives where, let's say, if I've taken to study even the CAP protocol, the histopathologic features, then I would like to connect my markers with some of the histopathologic features or with the clinical features. So I could have secondary objectives. So remember, AIM is broad, single objectives, 2 and more. But as if I say more, it should not be 5, 6, 7. So again, 2 to 3 or maximum 4 objectives is what is recommended. Now, having said the number of objectives, you also need to be very cautious that you have smart objectives. What do we mean by smart objectives? Your objectives must be very specific to what you are trying to do in your study. There should be some measurable outcomes that you are trying to figure out, and it has to be achievable. So you remember that you are doing it within the resources available to you. So whatever objectives you're stating, you should be able to achieve it. It should be realistic and should be possible to do it within the given time period. So remember that most of you don't have, even though your PG course is 3 years, you don't really have 3 years to do your research work. So you probably will get about 1.5 years to 2 years to complete it. So make sure whatever objectives you decide can be done in the given time period. So make sure your objectives are smart. Now let's look at what goes into the review of literature. So a good way to start working on the review of literature is to look at who's doing good work in the field that you are interested in. So there'll be many people, there could be even local people who are doing excellent work in your area. So it's not necessarily that it has to be national or international. So please identify local researchers who have done good work, national researchers who have done good work, international researchers who have done good work. You could also look at the impact factor of journals and look for good articles which would be your reference material for being used in the review of literature. A review with a purpose. Now, I stated one research topic saying that I'd like to study ER and PR in male breast carcinomas. Now, it's not really worthwhile reviewing the entire breast carcinomas when my main area of interest is male breast carcinomas. So I could say a word or two on carcinoma breast in general, but then most of my review should be revolving around carcinoma of breast in male patients, because that's what is my idea. And the second important point is I want to study 2 markers in male breast carcinomas. So you must narrow down the articles that you wish to look for in your research. Read, understand, and summarize. So this is very important. Often you get confused where to read, what to read. So you must read the articles, jot down small points. Whatever you find seems to be very important, jot down those points and get down a summary of each article. So this is very, very useful to write your review. Now, what should you look at? Look at the background. What was the background that other researchers looked at? What was the purpose of their study? How did they approach it? What kind of materials have they used? What were the methods involved? Is it that you could use similar methods, or do you need to tweak it to suit your study? What were their relevant findings? What have they discussed? Now, going through the discussion also gives you, the gap of their study. Some researchers will mention that we have done this and this. A and B were our findings, but we could not work on area number C. So that becomes the gap of your research. So it's very important to evaluate the articles that you are picking up for your review article. Always try to understand them and make a short summary of each article, which can then go into your review of literature. You could also touch upon some of the present controversies revolving around your area of study and any other important recent discussions that you come across in your review of literature. And as has been told to you, please do not copy and paste, and do not be critical of others' articles. We want to evaluate it in terms of what's good, what's bad, but we do not want to be very critical of others' articles. So that's not the purpose of review of literature. Now, certain points that we like to highlight based on some errors that we usually find when we go through articles. You need to write interconnected paragraphs. So if you have written around 10 paragraphs, there must be a flow of content between paragraph number 1 into 2 into 3. So we must have interconnected paragraphs, which reads almost like how you would write essays in school. If I were to remind you, every paragraph connects to the next paragraph. There is a sequence to it. So you need to write your review of literature in that manner. Use scientific language. So spoken English is slightly different from the language that we use to write in scientific articles. And here you could use your journal articles as your reference to see how other authors have written. So let's again look at this example of expression of HER2/neu, ER and PR in male breast carcinomas. So let's say that's my research topic, that's the title. And let's look at a review of literature where 2 paragraphs have been written. So the paragraph 1 has 2 lines in it. Breast carcinomas is a very common disease in India and worldwide, and it results in high morbidity in patients. And in the next paragraph, we have written that ER/PR are common hormone markers used in the diagnosis of breast carcinoma in females, and it can be used in male patients also. So there's a kind of sudden disconnect. Paragraph 1, I have been talking of breast carcinomas. So but though my research topic was carcinoma breast in males. So now the question is, can I write about breast carcinomas here? Yes, you could write a line or 2 about breast carcinomas, but then I have totally missed discussing the male breast carcinomas here. So it's become a little irrelevant. Again, my paragraph is very short, only 2 sentences used over here. And if I look between paragraph 1 and 2, I could have added some relevance as to why I've suddenly started discussing ER and PR here. So I could have probably said that, these hormonal markers have therapeutic value and, it is used there. And now if you look at my paragraph 2, I have used a term which is known as diagnosis of breast carcinoma. So scientifically, I do not use ER/PR for diagnosis, but it has some other implications. So the use of the word diagnosis is scientifically inappropriate in this context. So hence we must critically evaluate what we are writing in our review of literature. Now the other thing that is missing in these para 1 and para 2 is referencing. There are no references put over here. So I must again put references. If I am saying that the disease is very common in India and worldwide, then I must have 2 references there, at least two. One referencing that the disease is common in India and the other referencing that it is worldwide. It would also be useful to add some content in terms of percentages. How common is it? Some prevalence. So a little extra contextual information would be better. Now, when I'm saying make big paragraphs, we often sometimes even notice that sometimes the paragraphs become more than half a page. So that's again not an acceptable way of writing. So we have to maintain a balance between, it shouldn't be too short a paragraph, it shouldn't be too long a paragraph, and maintain a sequence between paragraphs. So what are some of the common errors that we notice? It is scientifically incorrect statements. For example, I told you that in that previous slide that instead of saying therapeutic implications, I mentioned that it's used for diagnosis. So that's not scientifically correct. So I need to counter check again and again whether what I'm writing is appropriate based on the information I'm getting out of journals. The presence of disconnected paragraphs in terms of content. So please make sure there is a flow of content from one paragraph to the other. Very large or too small paragraphs. Grammatical errors and typographical errors. So this is totally under control of the student. So you as a student must take care of these errors, and these should not be found by your guide. So please ensure that there are no grammatical and no typographical errors which your guide should be picking it up for. So these are some of the things, if you take care, it would make your review of literature a very beautifully written review of literature. Now coming to materials and methods, if you go back to the talk by Dr. Surekha, I think that's available for you in the YouTube channel. A very good coverage of this has been done. So we will just go through the important sequence of some of these or some of the subheadings that come here. So basically we're trying to cover how you're going to do your research, what are you going to do in your research, and whom are you going to involve. So this whom can vary based on whether your work involves people, or are you working with certain samples, or it's a questionnaire based study. So the whom will vary based on that. So under materials and methods, it would be a good practice to use these side headings. And again, let me remind you that every university has certain recommendations for this. So please use your own university guideline when you're doing this. So I'm telling that again and again, so that different universities may have different requirements. So one set of guidelines may not fit all of you. So you look at the study setting. Where are you doing the study? Are you doing it in a hospital setup? Is it in the lab? Or you may be doing the study, let's say somebody is doing a study in the orphanage. So the study setting varies from person to person, maybe in the hospital. So use that study setting. What is the study design that you have developed for your study? So this was again extensively covered in our previous session, so I'm not really going into the details of study design. Who is your study population? So this is very important to identify. So sometimes we don't have people. We may be using samples, which is very common in our pathology subjects, while people from the clinical side may have patients as a study population. What is your study duration? So you need to identify your study duration very clearly. And this is again important so that you know what is the time period available for you to collect your samples, what is the time available for you for data analysis, and when do you complete your dissertation. So study duration needs to be very clearly put. What we regularly use is the study duration starts from the time you take your ethics committee approval to a point where you want to completely submit your thesis to your university. Then again, look at your sample size very clearly. Now, this was also discussed earlier, how to calculate sample size. Whenever you need to, where you need to use which kind of formulas was all told to you in your previous session. So I would refer you back to those earlier sessions if you have missed this component. Let's look at this inclusion criteria and exclusion criteria. So inclusion criteria is often told quite easily by postgraduates, is what we notice, because you know what you are including. But it's the exclusion criteria which becomes a little absurd sometimes. So let me give you an example. Let's say if I'm taking the male breast carcinoma patients, I am not the female breast carcinoma patients actually does not automatically become your exclusion criteria. The exclusion criteria should include things which could affect the interpretation of your study. So let's say I would exclude patients who have undergone radiation therapy. So that could be one of my exclusion criteria. Or let's say I'm studying something in diabetes, and then patients who do not have diabetes do not come into the exclusion criteria. So you have to think, what is it that is going to affect the interpretation of my sample. So maybe patients who are having hypertension, they may add other secondary pathologic changes which can affect your data. So those patients, or patients who are having cardiac disease, they may have other changes which may affect the analysis of your data. So those become your exclusion criteria. So look very carefully as to what you are putting as your exclusion criteria. Then definitely you need to figure out what are your tools that you're going to use to collect your data. So it could be your proformas, it could be your questionnaires, so you look at, so all these needs to be decided at this point of time, and you need to put it down very clearly. And if you are going to have proformas and questionnaires, please remember that it has to be validated and sent to the ethics committee for approval. Test procedures needs to be added in great detail. So the entire procedure needs to be mentioned. Now, if the procedure is very long, you could still add it as an annexure also. Then you need to mention what are the outcome variables that you are likely to get from your study. The data collection methodology, what is the data analysis method that you are going to use? What is the software that you are likely to use? A good help for people who are not comfortable with statistics, it is good that you go to a statistician and look at the contents of this slide very carefully with a statistician, and they are very good at helping you out with it. A point of caution while going to statisticians, you need to very clearly explain to them your outcomes. So what is your study population, what kind of study you wish to do, and what is the likely outcome needs to be explained to the statistician so that they can actually tell you what are the good statistical methods that you can apply to your data set. And maybe a good parent reference article would do a lot of help when you are going to the statistician. So that's something I would like to stress on. And definitely you need to mention about the ethics committee approval. So that's the most important part of your study, without which you should not start your dissertation at all. So all these things need to come into your materials and methods. So what are the ethical considerations we need to look at? You have to get an IEC or the Institutional Ethics Committee approval. And every institute has one, so you need to send your protocol for approval to them. If you are working with the patients, then you need to also talk about what are the potential risks or the benefits to the patient that you're expecting. So that needs to be very clearly told. But if you're looking at pathology studies, most of us work with tissue samples or stored data. So in that case, there would be no potential risk or benefit. Again, if you're working with patients, you need to have a consent form. And if you're working with younger children, or if your subjects are less than 18 years old, you need to have what is known as an assent. Assent is, in our Indian law, only people who are above 18 can give consent to participate in a study. People younger than 18 cannot give direct consent. So you need to, include their guardian or their parent, and also explain the entire process to the child, and that's what is known as an assent. So much so for ethical considerations. The next part, important one, is the implications and the knowledge gap. So let's look at these two. So depending upon the type of study, you could have different types of implications. So you could have, your study could have academic implications. If you are doing, a study in relation to students, it could have a more social relevance or may have importance to researchers. If you're doing a more research-based, disease-based study, so you could look at these kind of implications out of your study. However, you could also look at what is that area what is that area that can be filled by the new research that you could do? So that's known as filling the knowledge gap. So as you're reviewing, going through the articles, evaluating your articles, please see, you could make a list. Okay, article number 1 has worked on area number 1. Article number 2 has worked on area number 1 and area number 2. Or then again, go back to the article and see what are they saying can be done next. Or what were they not able to fulfill or look at completely. That gives you the knowledge gap in the area you are looking at. So I hope sometimes there is a little confusion about identifying this knowledge gap. So knowledge gap can be figured out by looking at different research articles, seeing what they have already studied, and what is it that the researchers are telling you, okay, we could not do this in our study, so this could be worked on further. So that helps you to find the knowledge gap for your study. So these two things are different and needs to be identified. And if you evaluate all your articles that you picked up for review of literature, you would be able to figure out the implication and the knowledge gap of your study. Now here comes another important component of your synopsis, that is the references. Again, referencing has been talked in great detail yesterday. Now, most of us follow the Vancouver system, but if your university requires something else, say a Harvard system or some other system, please follow that system. And on an average, I could say that it would be good to have 15 to 20 references. But again, if your university says less is enough or more is required, please use that criteria. And remember that the references always needs to be cited in your introduction and review of literature. So that's very important. And the correct way of referencing has been dealt with in one of our previous sessions. Now, it is good to have most of your references from published articles. We're not saying that you can't reference textbooks. Definitely you can. We have good reference textbooks. But you should not have a list of references which is only and only textbooks or predominantly from textbooks. So choose, if you have 20 references, it would be good to have 10 to 15 at least, journal articles and 4 to 5 books, or maybe less. So try to limit the amount of textbook references that you are using. Annexures. Now, a lot of content that you're mentioning in your materials and methods, if they are very long, could be attached as an annexure. So what goes into the annexure basically are your tools for data collection. That is your proforma. So you need to create a proforma, and or if you are planning to use a questionnaire where you want to ask patients something, or you're doing a questionnaire-based study, then that becomes the predominant tool for your data collection. And remember that questionnaires, proformas have to be validated before you attach it and send it to the ethics committee for approval. So proforma should have your patient ID. And please remember, you are not supposed to write patient name. So I'm telling that again, in your proformas, you should never have any area for patient name. There should only be a patient identity, because you need to de-link the patient's identity from your data. So that's an important requirement when you're sending, and it's basic of ethical conduct of research. So instead of saying, we all tend to put the patient's name. So stop doing that. So each of these you should have a sheet where you're linking the patient's name to a number, and that number should come into your proforma, right? So that's very, very important. So proforma should also have the methods by which you are going to do the study. So let's say you're doing work on some markers. Then how are you going to read those markers? Is there any particular criteria you're going to follow? how are you studying all your cases? Do you have a protocol, a standard protocol like a CAP protocol that you're following? Then the details of that must also come into the proforma. A well-formed proforma makes the conduct of your research very easy and also helps you to extract data from your proforma. So when you're creating an Excel sheet, it will be very easy for you to transfer data from your proforma to your Excel sheet. And if you're working with patients, you need to have an annexure of what is known as a patient information sheet, where you will be explaining to the patient what is the kind of intervention you're doing. And let's say you're writing this in English and your patient population is, speaking in some other language, then translations will be required. So let's say in my area, most patients speak Kannada or Tulu. And if I have patients coming in from, the neighboring states where they speak Malayalam, then I need to have patient information sheets in that language also. And as I've already explained earlier, the difference between a consent form and assent form. So assent form is required for all pediatric related or less than 18 years related research. Otherwise, a consent form is adequate. So a well-written proforma, questionnaire, patient information sheet, consent or an assent form is required in your annexures. So I think these are some of the common things that are there in the synopsis requirements of most of the universities. But there are a few things that I have found in some of the universities, and these are good to have in your synopsis. Again, please refer to your university guidelines if you need to use it. So you will need to decide based on that. So one is to have a budget, a sheet where you actually write down, what are the things you will need to conduct your research and what is the money. So let's say if I'm talking about pathology, I need slides, I need stains, I need special stains, I might need an immunohistochemistry marker. When I'm doing an immunohistochemistry marker, I have to be aware that I need primary antibodies, I need secondary antibodies. So having a budget helps you very clearly put down the costs of each of these, and you will then exactly know where you stand, and this would also help you decide whether your study is feasible. Otherwise, what you may end up, spending a lot of money than you ever thought that you need to spend on your thesis, on your dissertation topic. So this is another important thing that you could do, but all universities may or may not have this. The other thing that some universities do mention is to mention the timeline of your dissertation. So I have just put few of the important points. So a timeline is when you say, when are you going to start your literature review? And I have put some dates as October. So let's say you're starting this month. It tells you, when you're going to give it to the ethical committee for submission. When do you start data collection? When do you start your data entering? When does the dissertation writing start? When do you complete? So the entire timeline is put on a sheet of paper, and this helps your dissertation move in a correct time. So it will ensure that you don't rush towards the end. Now, timeline is when you put it in this kind of a linear fashion with the month and year mentioned on the side. Now, there's another way of putting this, which is known as a Gantt chart. So this is what is known as a Gantt chart, where again, I have listed the same things on the left-hand side in the column. And on the rows, I have mentioned the month and the year. So when you represent it in this form, it is known as a Gantt chart, while in the previous slide, what I showed you is a representation known as a timeline. So a Gantt chart gives you a better view across time. For example, in this, I have shown that the literature review is occurring starting from October 20 to December 21. So you can actually see that, of course, literature review is not a one-point effort. you are going to constantly be getting new articles. You'll be constantly updating your review of literature. So it gives you a timeline as to till when are you going to continuously do your review of literature. So these are two different ways of representing it. Now, some of your universities may or may not have it, but this probably would be a good thing to keep with you, even if it's not a mandatory requirement in your university. It helps to keep your research going within a good period of time. So I think we've covered most of the things. So let me just summarize a few pearls for writing a successful synopsis. Very important to plan. So this is the most important thing, is to plan your study and to stick to the time schedules. This will ensure that you don't rush to the end. Identify every single section of your synopsis, understand what it means, and write appropriately. Use good, smooth transitions when you're moving from one section to the other. So there should be a connect. So when you're writing your introduction, paragraph 1 should be connected to paragraph 2. Similarly, in review of literature, you should be able to connect your different paragraphs. So it should be like reading a good storyline about whatever you've written about your dissertation topic. Again, I am reiterating this to use future tense in your synopsis, because the study has not been completed. You're yet to do it. So you will be saying that I will be doing this. This will be done. While if you look at research articles, you are referring to articles where they have completed studies. So in synopsis, use future tense. Please check your grammar and please do a spell check before you hand it over to your guide. So that's very important. And last but not the least, I would like to say again, please own your work and be responsible for its quality. And once you own your work and you feel that this is something that should be done well, you want to have one of the best synopses that you'll ever submit to your university. And I'm sure you'll be able to satisfy your guides too, which is what most of you want. So happy synopsis writing. And with that, I come to the end of my session. Thank you.
I think Dr. Sharada, as your title says, is really a very smart talk you gave. You gave the pearls in each and every step. I think once the resident or a postgraduate knows the anatomy of synopsis, I think he will not have any problem to complete his dissertation when he completes his 3 years of course in any subject, starting from anatomy to the general medicine. I hope all the residents and the postgraduates benefited by your talk. As you rightly said, once the postgraduate thinks that is his own topic, is his own dissertation topic, I think there is no stone unturned in the entire 3 years course of his tenure in any college or any university he is studying. I think there is one question from Dr. Krishna Prasad. He is the professor. He is asking a question: what is the maximum budget allowed for a thesis? Is it ethical to have too much budget spent by a postgraduate for the thesis work?
I could not generalize, but overall, again, every university takes a call. And usually when it goes to the ethics committee for approval, the ethics committee asks the student whether they are willing to spend. Now, some ethical committees also have a cap to the amount of money that can be spent, because postgraduates are considered as vulnerable population. So there may be some kind of a fear among students, like if I do not spend the required amount, there could be some other repercussions. So the ethical committee usually takes care of this, but there is no written recommendation as such. So a good way would be for most head of the departments is to probably take it in writing from the students saying that they're doing it on their own accord. And definitely the ethics committee could have a say in this.
Yes, there is one more question. I think you have already touched during your presentation. I think Anugya Behara. In review of literature, we need to mention from which year, question mark. Suppose we write in 2020, we need to mention from 2000 or before that.
I didn't get the second half of the question.
She's asking, he or she, I don't know. We
Yes.
need to mention from 2000 or before that.
Okay. Yes. So I think a lot of it would depend also upon what you are referencing. So let's say if I'm taking a topic like leprosy, which is quite an old disease. So I may have one or two old references, when I say that leprosy was first discovered in this era. So, but majority of your references must be recent, so after 2000. Or let's say if I'm doing for the topic I just mentioned, ERPR in breast carcinoma, if I'm doing, then there's a lot of research being done recently. So then I would prefer that most of your references are probably in the last 10 years also, may not even be, 2000. So you could have 2 or 3 articles which are very old. The remaining should be more recent.
I think there are no questions after that. I think Dr. Sunita, do you have any questions? I think Dr. Vijay Shankar also there. Any questions?
Should be any, since Madam has done it so wonderfully.
Yeah,
that was an awesome presentation, Madam.
Thank you.
Really very, very smart.
There is a question, ma'am. Could you elaborate on consent for using blocks for ISC or just clinico-pathological correlation? IEC approved always asks for these informed consent.
Sir, can you just repeat that question?
Could you elaborate on consent for using blocks for ISC, that's immunohistochemistry, for just clinico-pathological correlations? And he asked one more. She asked one more question. IEC approval always asks for these informed consent.
Okay. I think if you are looking at blocks, they come under the category of retained samples. So there is a clause even under ICMR where these retained samples go under the category of exempted from a requirement of consent. Now, we are just using data, and that is why it is very important to de-link the patient details from your data collection. So that's why I mentioned in your pro forma, nowhere should you mention patient name. Each patient is just given a sample ID. So your work is primarily on patient retained samples, and that is exempt from informed consent. So you could probably refer back to the ICMR guidelines for this, and this would give you some clarity.
Yeah, there is one more interesting question. That is similar to training for PGs in research methodology. Don't you think periodic guide training is also required?
Yeah, I think it would be useful. Probably each of us could do at our institutes, or maybe KCIAPM itself may come up with something for you all.
Yeah.
Exactly, Madam. We all should learn regularly. That's the need of the hour. We can't be sitting here and saying that we know everything and then students do everything.
I think wherever the medical education unit is active, they are doing this training job to the guides also.
Exactly.
Because as Dr. Vijay Shankar mentioned yesterday, the most problem is cut and paste. Cut and paste, it is so much so the professor of orthopedics is signing for Professor of Anesthesiology, because the anesthesia postgraduate has completed his dissertation a week back, which is happening now. The dissertation work is already getting into our college. Somebody is already completed dissertation, and same acknowledgement comes in the next dissertation review. So these are all things. As that's a valid question. The guide needs to be updated time to time or refreshing the knowledge. There is one more question. Can the postgraduate get his work sponsored, like maybe from a lab or a machine company?
Ideally, it is not recommended because that would involve conflict of interest. Then it has to be declared to the ethics committee. And also, while publishing your work, you will have to mention that this work was sponsored or done under this. So that conflict of interest gets declared.
Yeah.
Source of funding and conflict of interest should be declared if at all they are using it.
Yes. And it should go through ethical committee approval for the same.
Right.
There is one question. I think you are already answered this from Dr. Praveen Kesri. What points of an article should be taken for review of literature?
Review of literature could go across many different areas. Again, it is based on what we are, actually researching. So that would drive what we are writing. So you could write a little bit of history of the topic. You could write a little bit of the disease per se. And let's say if you're doing some marker or whatever is your intervention that you intend to do, you will have to connect your intervention to the disease. You could talk of, what's the present status of the other kinds of interventions that have been done already, and what can be added, and maybe a little bit on how, what would help if done more in a particular area, and a little bit on the gap that you are trying to address. So you could have different, and also work done by different authors in similar areas. So what have they already done? So that also could be touched on.
There is one question from Dr. Aditya Priya. Suppose I am studying an ISC marker in a carcinoma cervix and its clinico-pathological correlation. What should I write in review of literature?
Okay. So,
it's a long question, actually.
It's a long question. So, probably you will be talking about the role of the marker. What are the problems in the diagnosis? Because I need to know what marker you're kind of doing, because that would kind of tell what you are looking at. So whether it's a diagnostic marker or, which is kind of differentiating in situ carcinoma from invasive carcinoma, or you're looking at the association of, HPV with carcinoma cervix. So that would drive what you are writing. So if you're looking at diagnostic markers, you probably will have to discuss the other markers available and the role of the present marker that you are studying. If it is HPV related, then you probably could, start with the prevalence of carcinoma cervix, the role of HPV, and what has been done till now, and what is the area you are trying to address. I think that's in a broad way that I can tell.
I think there is one question. I think it is out of purview of this presentation. But however, the question is the National Medical Commission has made basic course in biomedical research mandatory for promotions. So at least an associate professor as a guide would be trained.
Okay. Yeah. I think now they're making it all mandatory, and there are even exams at the end of it.
I think that's all the questions. Anybody else? Dr. Vijayashankar, Dr. Sunita or Aditya around, you can.
No, I have only few things to say. I have to thank the entire of the Synopsis writing Demystified team which made this possible. Initially, we starting with a one day presentation, and then we decided this team was headed by Dr. Sunita Patil. She actually selected all the speakers, and then we have some more things planned for you all, who are watching this live. We are planning to come out with something like, how to critique a journal. That's one thing we have in mind. How to present a seminar is another thing in our mind. And we will continue this series probably with writing how to write a dissertation as well. So we have some more things online. You keep updated with yourself with, what can I say? I mean, you have to, Aditya, subscribe to the media channel so that you get updated. Yes.
Can I say a few words? I'd like to thank Dr. Jayaprakash for moderating my session, and KCIAPM for this opportunity to participate in this discussion, and definitely Dr. Vijayashankar, Dr. Sunita, Dr. Aditya, who have been regularly communicating and helping us conduct this program, and so also all the other members who have come together to make this program a success. Thank you so much.
Dr. Sunita, you have anything to say? Some disturbance with Dr. Sunita. Dr. Aditya?
Yeah, some disturbance is there.
Yeah. Get forward.
Anyway, once again, I thank Dr. Vijayashankar, the Secretary of KCIAPM, doing a wonderful job by getting all the residents, tutors everywhere from across India, getting into a common platform, and Dr. Sunita and Dr. Aditya, who's a very tech-savvy person. Within a minute or within 5 minutes, he will arrange you a meet and saying that your audio is right, your video is right. Yeah. And more so today's speaker, Dr. Sharda, and all the team of office bearers of KCIAPM. Thank you once again.
Thank you, sir.